In this module, you will see surgical placement of implants utilizing state-of-the-art CT scan and 3D treatment planning technology and surgical guides, proper abutment selection prior to surgery using simulation software, impression taking that ensures accuracy, post-surgical temporization techniques for immediate and delayed healing and function, proper setup of an implant-supported overdenture for aesthetics and function, and team treatment planning of fully edentulous patients.
What we're going to do today on this nice lady, with the help of my partner here, my prosthodontic specialist, Dr. Maha El Said, we're going to go ahead and we've taken teeth out that were hopeless in the maxillary arch. And what we're going to do here is we have planned, utilizing CAT scan technology, a treatment plan that would enable us to replace her missing teeth with 4 to 6 implants from the bicuspid to bicuspid, to support a future overdenture. This is her upper jaw, and I'm going to magnify the image very simply. Here we go. Recently, she's lost her front 4 teeth, the incisors. They were extracted about 8 weeks prior to this CAT scan being taken. You can see some of the bone loss that has already occurred. And I can go ahead and I can take even a closer look at this. And what you're seeing here is the extraction sites early on in healing, which is very interesting because I can rotate this and you can see the amount of bone that hasn't formed yet and how thin labial plates of bone can be lost early on in treatment. And we're going to treatment plan around this. What you're seeing here in the bottom is the duplicate of the radiopaque marker that I just showed you. So here it is, the teeth, here is the bone, here's the floor of the nose, and here are the sinuses on either side. And what we're going to go ahead and do is, I have already taken the liberty of planning where the implants are going to go. Here are the implants with appropriate angulations, and you can see how I've worked to avoid this very big defect on the canine on this side as well as on this side, placing an implant behind and in front of it. And one of the things I'm able to do as well is I can go ahead and I can make a transparency. What you're seeing is the implants, how they look through the bone, and you can see we have 6 implants to restore hybrid prosthesis, taking this patient from a denture all the way through to a hybrid prosthesis the day of surgery. What we'd like to do today is really be able to incorporate placing the implants where the bone is, placing it in bone that's of good quality, planning out the abutments inside the restoration, having all the components available, and really being able to take a patient from a removable denture that's been wobbling and moving around the day of surgery and transferring this into a hybrid prosthesis that's very stable and very secure. One of the other issues is that I can go ahead and take a look at how the angulation is. I want to make sure that in this case we have the angles that we want for the restorative dentist. So let's go ahead and take a look at that. Here it is, the angulations of these screws are going to be coming out right where I need them to be, right behind the prosthesis. And if I really want to take a look, I can remove the bone entirely and take a close-up look at how this comes out. Here are the 6 implants. Why is this important? Because I can now discuss with my restorative dentist the angulation concerns. Take a look at how the bicuspids and the implants in the posterior and anterior are going to line up. We're going to use angulated abutments, and you're going to see during the surgery. And you can see as I turn this around in 3 dimensions how everything can be lined up exactly well on the model and then taken into the mouth. And we're going to show you how we can do this. Look at this technology, which really enables us to plan. These green pieces are the abutments and the red is the implants. So basically it gives us very, very precise rendering of the screw axes, the angulations, and of course our ability to correct those angulations. So we're going to go ahead and put the bone back, and there it is, and go back to transparency. And now we're going to go back to the image on the left screen. Now let's take a look at how these look. We're going to go ahead and expand upon the lower arch. Here are the 6 implants being inserted. We're going to go ahead and you can see that we're going to avoid the sinus on the left side, avoid the canine extraction defects. So I'm going to place my implants in front of the sinus and behind the canine defects, 2 in the central area and 2 posteriorly either side, giving us a tripod. We're then going to go here and we're going to enhance this image here, and we're going to take a closer look. Here is the teeth. This is where the radiopaque marker is for the central incisor. Here's the angulation and the length of the implant, and I can choose the type of implant I want. In this case, this is going to be an ankylose implant. This is going to be the transmucosal part of the abutment. This is the area that's underneath the tissue, approximately 1.5 millimeters. And this is the radiographic, radiopaque part of the tooth form. So we know we can place the implant. Here's the floor of the nose. We're going to go ahead and go with 11 millimeter length, 3.5 diameter. And this area here, if necessary, we can go ahead and graft it. But you can see the screw access is coming right where we want it in the cingulum region behind the incisors. So from a restorative standpoint, we can start to interact here. I can remove the implant. You can see what the socket looked like before. Go ahead and place the implant in that area. Once we do that, other issues is we can work our way through and take a look at how it looks like on these films as well. So we have every single section can be blown up and evaluated. You can see again, avoiding the cuspid defects. This is what it looks like. Now, one of the things that I've been very fond of utilizing is going back to the 3D image and giving you something that's very, very unique, I think. We can go ahead and take a look at, from the surgical standpoint, axial or cross sections. Right at the area we're going to place our implant. Take a look at what it looks like now. Here's where the teeth need to be. This is the bone. This is the alveolus. You can see we have at least 2 millimeters of bone on the labial. And look at the axis as we turn it around. We're going to be coming out just lingual with a 15-degree angulation. So this tells us exactly what we're going to need from a restorative standpoint to gain the appropriate angulation for the restorative dentist. See the 15-degree angulation here, and then we have the angulation that we have with the back of the mouth. Now, another aspect that we can look at, you can see this section's being taken right at the midline. I can rotate it around and see the other half as well. So this is what it'll look like in 3D if we make a cut right at the midline. And this gives us an idea of how far we are out of the bone with the abutment, when the teeth start, and this is just enormous information. So if we take a look and we go back to putting the bone back in place, and we're going to go ahead and remove the cross section, we can go ahead and take an axial section as well. And take a look here as we make our cuts. This is where the implants would be sitting on top. From this point on, this is going to be sitting in bone. These are the angulations in the ridge. If you can look from the top down, you can see the precision and the placement are completely inside the ridge. And this, just another thing for the surgeon to understand that all of these screws are going to be completely embedded in bone. So this information obviously can be taken to the mouth, and once we have everything planned out, we can go ahead and have the models made by Materialize. Now, what we do is once we are happy with the placement, size, the angulation of the abutments and the implants, and we can select off of the library what implant system we want, which is very easy to do here. We can go to implant, we can go to library, and on the library, I can go ahead and I can go, in this case, to Freedent, and I can go to which implant system they use. We're going to go with Edentulous, and then we have every single one of their products listed for me. So I can go ahead and say, I'm going to use, in this case, this implant and select it. So just another thing, you have a whole library of abutments and implants that you can choose from. Once I'm happy with this, I can download this information to their website, and they will then bring me back a stereolithic model of the maxilla. And this is what her upper jaw looks like. This is an actual rendering of her upper jaw in a plastic material. This is the sinuses. This is the front part of the jaw. Here are the extraction sites. And they're going to go ahead and give me surgical guides that will sit on the bone exactly where I need to place the implant. I'm going to be able to put this on the ridge. It's going to be stable. And I'm going to drill right through these holes with the 2 millimeter twist drills, giving me exactly what I had planned on the surgery. We're then going to go to the 3 millimeter twists. They're going to snap in after this one. And you can see that's going to go right over the bone as well. I'm then going to remove this. And I'm going to go to the final guide, which is dedicated for the size reamers I'm going to use for the 3.5 diameter implants. So this really allows us to place the implants exactly as we did on the CAT scan machine. So we've really taken this to another level. In the early 90s, we went ahead and were able to use CAT scans just to see where the bone was. Today we can go ahead and not only see where the bone is, we can also test the quality of the bone. Let's take a look at another tool we can use. We can go ahead and go to bone quality, and this is going to tell us what kind of quality of bone is around you. Just another issue that we can do, another piece of the puzzle that hasn't always been around. We can also go and make a circle here, and if I'm going to place my implant right here, it'll tell me Hounsfield units. The Hounsfield units are a unit of measurement of the quality of the bone. So not only do I know where I'm placing the implant, I know how dense the bone is where I'm placing the implant. In addition, we can then not only plan exactly the type of implant we're going to use, not just use a basic or standard default implant, but actually the implant system you're going to use is in the library. You can pick any system you'd like. They also have their abutments listed. So you're going to select your abutment and your implant, as I showed you earlier, and then you're going to send all that information off. And what we've never been able to do is be able to transfer the information from the computer to the clinical situation, and today we can. We can take this stereolithic model and go ahead and get stents made that will give me exactly what I planned on the computer. And this is really advanced technology. An additional issue that may, in fact, I believe will be in the future is you can take this model and drill onto the model and practice your surgery before the patient ever comes in, placing analogs into the stereolithic model and then planning out your abutments and your prosthesis before the patient ever walks in the operatory. I believe down the road what you're going to see is virtual teeth being able to be made on the stereolithic model based upon a wax-up by your laboratory. And it's very, very possible that in the next few years with this technology, you're going to be able to go right from implants to some form of immediate final restoration in many cases, certainly with final abutments.